Hello, how are you? Let me ask you a question. At the end of the day, when you take off your socks, do you have a mark on your leg? Many people notice their legs are more swollen, especially around the ankle, with a mark from the sock they were wearing, and they start to wonder, was it just that the sock was too tight, or is your body trying to send a signal that something isn't working properly? Today, I'm going to explain more to you about that sock mark on your leg and why it can actually be a sign of a serious health issue. Stick around until the end because you won't want to miss this. Before we start, I want to ask you, do you get that mark or not? Does it show up every day or only in specific situations, like when you've been standing for a long time or when it's hotter? How does it show up in your daily routine? Write it for me down below in the comments. I'd love to see your comment. And go ahead and leave your like because that's really important to me. And it shows YouTube that you support the channel and trust my content. And if you know someone who always has that mark on their leg, share this video. Let's spread this chain of kindness. One thing that many people are unsure about, after all, why does this mark appear? Why does it show up on the leg and not, for example, on the arm? By the end of the day, that shirt you were wearing, a longer sleeve shirt, doesn't leave a mark on your arm, but on your leg. Many times, it leaves a mark. It has to do with the issue of gravity itself. When we spend many hours of the day standing, especially as it gets closer to the end of the day, there's a greater tendency for us to have more fluid accumulation in our legs and feet. Because of gravity itself. Our body pumps blood through the heart to the extremities, and this blood needs to return from the extremities back to the heart. But there isn't a heart at the tip of your foot. There's no heart at the tip of your finger either. So what happens is that many times this circulation gets a little impaired and the very valves that exist inside our blood vessels may not be working so well. These valves serve to close and contract, and to make this return circulation happen as if they were little doors. There's also the matter of how your calf muscle works. I have a video here on the channel explaining why it is considered by top doctors to be our second heart. The more we walk, the more we move, the more we work this calf muscle, which squeezes these deep veins and pushes the blood upward. So people who spend many hours sitting still or standing for a long time tend to have this mark on their legs more often. Before we think more about what needs to be done, about the details our body is giving us, one important thing is exactly that question I asked you at the beginning of the video. Has this mark been occasional, or is it becoming routine? Because if this happens once in a while, on a hotter day, after a flight, after sitting for many hours in a car, traveling by bus, after being still for a long time, or after standing in line for hours in the sun, okay, there's a context. Now, if this happens every day, if it's getting worse over the weeks, it's worth seeking help from a doctor to investigate this further. It could be a sign that something is wrong. Before I continue the video, I want to give you a very important warning. One thing that's always worth checking is whether this swelling you have, this mark left on your leg by your socks, is bilateral, meaning it appears on both legs, or if it's present on just one side. That's a more reassuring sign for us, because it can often indicate venous or postural causes, or even something related to medication use, rather than a more serious issue. Now, when only one leg swells, it can raise other suspicions, including the risk of thrombosis. So it's important to see a doctor if this is happening, if your leg is red, if it's warm. It could be a serious sign that something more severe is going on. A test we usually do to check if this swelling is actually happening, besides noticing sock marks on the leg, is to use your thumb and press near the bone at the ankle, because that area is firmer with a bony surface underneath. So when we press there, if an indentation remains, what we call pitting, that suggests there's fluid buildup in the tissue. So that's an interesting point you can try right now. Take a look at your ankle and see if you have this persistent swelling or not. It shows whether you have edema, if you have fluid retention, and this can be related to the veins. It can be related, once again, as I mentioned, to venous insufficiency, this difficulty with venous return, this accumulation of fluid, of lymph, really, that stays there in our foot, in our leg. And many people feel that, in addition, the leg feels heavier, they feel pain in the leg, pain that only gets better when they elevate the leg, when they really try to give their legs a rest. So in some cases, actually, something that will really help is elevating your legs. At the end of the day, if you've been feeling this a lot, put your legs up, rest them against the wall, and let gravity do its job, in a way that's the opposite of what usually happens throughout the day. So in some cases, even a massage, a lymphatic drainage. There are some cases where compression stockings may be recommended, and if you're unsure whether you should use them or not, talk to your doctor in your city, because often you can wear compression stockings. There are basically 3 types of compression stockings. There's one that goes up to just above the knee, one that goes up to the middle of the thigh, more towards the upper part of the thigh, and there's one that's like pantyhose, which you can put on. You need to be careful with compression stockings before putting them on because it's no use if your foot is already swollen and you put on the compression stocking. In that case, it can actually do harm. Ideally, you should lie down for a few minutes beforehand or put the stockings on first thing in the morning before getting up. And then you go about your day, and at the end of the day, you take them off. If you have any questions, talk to your healthcare professional in your city to find out which compression level is best for you and whether or not it's recommended in your case. One thing we also need to mention is that salt can play a very significant role in leg swelling. Of course, salt increases fluid retention. So if you have more fluid in your body and you are more prone to retaining it in your legs, the more salt you consume, the worse it may be for you in this regard. So a good tip is to try to reduce your salt intake, not just added salt, but also from ultra-processed foods, drink plenty of fluids, and stay well hydrated throughout the day. Try eating foods naturally rich in potassium, such as potatoes, bananas, coconut water, legumes, and seeds to boost your intake can be a good option because the more potassium we have, the more we are able to excrete excess sodium and water through urine. So it can be a really good option. It's also worth pointing out that this swelling in your leg isn't always just from heart or venous problems. It can also be related to kidney problems, meaning difficulty excreting excess fluid through the kidneys. More advanced liver problems can lead to poor production of albumin and other proteins, which further promote edema or swelling. Low levels of proteins in the blood, for various reasons, can reduce this oncotic pressure and facilitate the leakage of fluid into the tissues, which can worsen fluid return and contribute to swelling over time. So even hormonal changes, women during PMS, perimenopause, issues related to hormones can increase this swelling. So the idea of this video, obviously, is not to diagnose anything. Diagnosis has to be done by a doctor in the office. This video here is purely informational. The idea is just to help you turn on a yellow warning light and tell you, if you've been experiencing this for a long time, go see a doctor to find out the cause. More important than treating the swelling, the edema, or wearing compression stockings is knowing what's causing it and preventing the problem. Remember, it's a sign your body is giving you that something isn't working properly. It's important that you find out exactly what it is. Now, if you notice that this is something that only happens occasionally, mainly when it's hot or when you've spent many hours standing, or on the other hand, sitting with your legs bent for a long time, things like that specifically. There are things you can do, like moving your ankles or maybe doing some squats to stimulate more movement, even standing on your tiptoes to activate your calves. This is especially useful during airplane trips, train rides, or long bus journeys. Any situation where you spend many hours sitting still. Every couple of hours, try to move your legs and muscles to help reactivate this calf pump and improve circulation. When you get home at night, elevate your legs with your feet above heart level without bending your legs. Keep them nice and straight for a few minutes to help with venous return. And as I mentioned, avoid sodium, ultra-processed foods, and make sure to stay well hydrated because that can help you. And talk to your doctor about whether or not you should use compression stockings. So tell me, has this been happening to you? What have you tried to do to minimize this discomfort? I would love to see your comment. Remember to like the video, it really helps me here on the channel, and share it with anyone who could use these tips. Let's work together to spread this chain of kindness. That's what I want with the channel. See you next time. Bye.